Welcome back. This lecture is about behavior intervention. Until today, we have looked at the power of devices and radio signals to detect and diagnose. Now, this lecture has a completely different angle, and it's somehow the follow-up of what we have. Once we have realized that perhaps there's a problem, there is a place we can intervene. How can we use devices to help this intervention? And I'll explain what I mean by intervention as well. So mobile devices, we've seen various sensors that can sense our behavior. This whole course was based on understanding that. And we will talk about using the sensors to guide the intervention, not only to say what the intervention could be, but also to understand what the next intervention can be, or the effect or quantify the effect of that intervention. So what is a digital intervention? So making sense of the passive data collection, passive data collected to inform what to tell the user, and to do so to solicit a positive reaction, a positive behavior. For example, if a person really wants to try to quit smoking, how do we support this person in their smoke cessation program? You will see, I will use this example in a couple of slides later. Smoking is very habitual. It depends on many things: time of day, location, social context, point of interest where you are. And so, and also there's the psychology on what to say at what time that comes into place in this sort of studies. Another example is to remind people to take their medications. Some medications are more difficult to be remembered. In some cases, medications have side effects. Have been part of a study related to blood pressure medications. There are side effects of those medications, so users are less incentivized to take them if they see the side effects. So it's important to remind them why they're taking and what's the higher goal, and how to mitigate perhaps the side effects. You probably have seen this on some of your devices. You can solicit a person to do breathing exercises to reduce stress, perhaps do that at the time when stress is high, or perhaps do that when they have time to do it. Or you can remind people to walk more, because for cardiovascular health, activity is important, and I will use this as my second example in this class. Some examples of this is also to support someone in their diet, and if you are more interested, also there have been examples of mental health applications to support positive behavior, not just in stress, but also in more clinical cases. In the mobile and wearable health seminar series that runs in parallel to this course, we had a few examples of applications of that. So you can watch the recordings if you are not in the lecture, in the seminar. There's pull and push interventions. Pull interventions are the most straightforward. It's guided. A pull intervention is guided by the user. The user realizes that he would like to know more about how can they improve their behavior and request the intervention. And here is an example: someone checking how many steps they've done in a day. So they're really aware that activity is important, so they go into an app and check their steps. Now, we can talk a bit about how this information is conveyed to the user. This is also very important. It's related to user interface and user interaction with the information. And even just the delivery of this information, which is solicited by the user, could have different effects on the user. So that's an important factor. We won't talk about the details of that. Push intervention is a device prompting a user with a message. For example, a watch indicating that you haven't closed your activity ring. I don't know, many of you received certain messages, but these are soliciting you to perhaps go out and do a few more steps to close that ring. Now, obviously, in devices, commercial devices out there, the theory behind when and what message is delivered to which user and why is not clear. But there are academic studies that study these sort of problems, and that's what we will be talking about in the next few slides. So I've already described the problem of smoke cessation. Someone wants to stop smoking and they need support. And there are apps starting to be available for this. This is one that actually we have prototyped and developed. You see there is a location in the picture, actually, that particular hotel has changed name by now. But the message of the app is an Android app that sends a message to the user in a particular location at a particular time of day. The message in this particular case reminds the users that lots of smokers say stress is the reason why they give up stopping, so they kind of relapse. And in this message, the user is kind of pushed to hold on, to say, well, don't give up. Your efforts so far show that you can handle stress and work. And anyway, so it's a listed message delivered in a particular location, perhaps a location where the user generally at this time has been seen smoking. Now, how do we, if we were, in the app, in this particular app, how is the context sense? Well, we have location data, we have time of day data, and for a certain training period, the app was asking the user to report when they were smoking. So let's say for 10 days before the quitting date, the user would report, I'm smoking now. And the app would contextualize this with the passive sensing information and see and use that later to then push customized messages to the user to support their effort in quitting smoking. There are various forms in which digital intervention takes place. This is one that is also commercially available, and it tells you, take a minute to breathe, and then you start an exercise to breathe. This is a second example of an intervention. The first one I've just shown is the smoking cessation one, where that motivating message was shown at particular time. So what are the challenges of all of this area? Well, what message to send and to which user, because users are different. They might be receptive to the messages. You will see in some examples, and some aren't. Some users aren't. And when to send the message. Avoid bad times. When I'm sleeping, I obviously don't want to receive notifications. What are in the times that the user considers themselves available, which can be defined in an app so that notifications cannot be received at bad times. There's still the question of finding the best time for this to be delivered. And also automatically perhaps avoiding to deliver a message when interventions won't be useful. So for example, if this is an intervention asking me to walk and I'm already walking, there is no real reason to send that message, and the user might get annoyed by the lack of understanding of the app. And separately to all this, there is a question of evaluation. So when we produce an app that has the aim of intervening and helping the user, we want to know if it worked. So how do we know if something works in this context? And some of the examples I'm giving today are really about how you make sure you have enough randomness or diversity in the study to show that a message sent to a user, perhaps in a certain context, on a certain time of day, is working. Because a message sent on perhaps a different day at that time with the same weather wasn't working, or maybe it was working as well. So you try to change the context and see if the user, so for example, if I receive a message at lunchtime and the weather is good, and then I go walking, what if the next day you don't send me a message and check if I'm actually going walking independently? And this is it's a very complex area where health psychologists are stepping in to understand what works. And we won't talk too much about the psychology, but it percolates, it just creeps in because it's so interleaved with all these concepts. And so some messages might be simple, but some might require some attention from the user, and that means, and perhaps even some interaction with the device, so you need to be careful on when to send them. And some messages might be better than others, and you might want to check what message works for a certain user. You have that information coming into the app. You see if a user is responding to a message or is not responding to a certain kind of message, so you could adapt. And we will see that some reinforcement learning techniques have been adapted to be used to dynamically adapt the application. And context, of course, some time of day might work better for some of the interventions. I've given you the example of smoke cessation. Smoking is very habitual and depends also on time of day. So when you send those messages is very important. In the next two slides, I'm giving you examples of messages that exemplify things that can be sent on a mobile app. This is the Increase Your Step Count app that was developed by the group of Susan Murphy in Harvard. And on the first column, you see the various suggestions. Is there anything better than weekend afternoons? You can enjoy the fresh air by taking a walk around your neighborhood. And the idea is that they've considered the time of day when it's best to send this in general, the type of a day, and they're sending it on the weekend. The weather, obviously, if it's raining very heavily, they wouldn't send this, and they are sending it if your location is at your home, so you can go and walk in the neighborhood. So all of this list, and you can read it in your own time, is also dependent on the context that can be sent through the app, and in fact, through simply time of day and weather can be collected in different ways. This is another example that we have done on the QuickSense smoke cessation app. So some of the messages were related to some people find that they can reduce stress at work by prioritizing their work, breaking tasks into smaller steps, and talking through any problems, deep breathing, and having breaks can help too. So this is about reducing stress. Second one, try to avoid taking breaks with people you used to smoke with. If this is impossible, avoid seeing them smoking by taking a short walk instead. And the conditions of where these messages are sent are described by the other column. So similar approach, health psychologists are trying to decide when these things are best, and then the context from the sensing app is helping to decide when to deliver. And we've seen that the context can be sensed. We've seen it throughout the course, location, even social aspects through BLE, so you can check how many other devices are around. You could even, we haven't done it in the app, but you could even record the BLE devices in a training set saying, okay, these are devices that should be known to the app. These are my friends. And you can do it reasonably anonymously so that your app knows that when you are in that context, it's best, you're in a social context that might be related to your smoking, and might build that into the context of when you're sending certain messages. Time. Microphone has been used for surrounding sound ambience detection. There are papers showing that this can be done. You can distinguish the sound of a coffee shop from the sound of a different working environment. And so you could try to use that for that. I haven't seen much effort in trying to use it, but it would be very interesting to do so. Activity through the IMU, we had lectures about that. So if you're already walking, not sending a walking message, well, this could be detected. You could decide. You can also use that to understand if the user has followed your suggestion by deciding that the activity is happening. How many steps are you doing today? And we'll see an example of this in practice. How do you know if an intervention works? We've had a little look ahead about this, about randomization. So we want to know exactly what message work and when and for whom, for which user, right? And we also want to know that there are factors that could be studied, such as the weather, the time of the message, the user characteristics, and the demographic. And so we need to have some randomization in the study to control for the variance of users and context, and making sure that what we are detecting is a sort of causal relationship that is not caused by the fact that but it's caused by the message. So I'm walking more because I receive messages and I listen to them. I'm not walking more because the weather's just suddenly got better and I decided that the weather is good and I'm walking. So the messages wouldn't have an effect in that sense. But how do we distinguish the two scenarios is very, very important. And so here is a paper that looks at helping the improvement of number of steps per day of users. Messages were sent 5 times a day with a certain probability, so 30% chance of sending a message in each of the time windows and 30% not. There was an additional evening message to plan for the day after, which was a bit more involved, it required more reading. And the messages had 2 types of suggestions. One was a bit more involved than the other, and one was lightweight. And how did they, what did they follow? So, well, after delivering the 5 times a day message, they would then record the activity of the user in the following 30 minutes. So they would know what the action, if the user took action in next 30 minutes. So the randomization, I should say that the randomization message sent or message not sent was to allow to understand the causality effect. So if you have a lot of it and a lot of users and quite a bit of time, you would be able to distinguish the cases where really you're making a difference and you're not making a difference. There was also a way to allow the users to say when they weren't available. So notifications stopped because perhaps the users had decided to say, well, I'm in a meeting at this time, or please don't send me notifications between 9 p.m. and 9 a.m. So the things were user-based, but also sensor-based. One was if the user really doing activity, really the step counting, well, don't send that message because it's annoying and it's actually stupid and not very useful. The results provided results that suggested that the application worked, step count up by 66% on the first day of the study. But this effect diminished linearly over time. And by the 28th day, there was no effect. So people kind of habituated to the messages and they didn't find them useful and didn't follow them. So they tried to improve this by considering the fact that their way of sending messages was fairly static. It didn't go back to it. It didn't depend on anything else but the time of day, this time of day and the probability of sending or not sending a message. And they didn't consider the previous history of the user, how the users had behaved in the days before. And they thought they should change this. So they have a new version that adapts to previous intervention. They also added other constraints that the user had to be sedentary for the past 40 minutes. The probability were adapted dynamically, and you couldn't send too many messages per day, you would have a really hard cap. But the really big innovation was the use of reinforcement learning algorithm to improve. So that would be based on what was learned on the previous day, and that would be put in practice on the next day. So the idea is that over time they had a state, an action, and a reward. The action was sending or not sending a message, and the reward was this aspect of checking if the user had in fact walked or non-walked over that period. There's a small note down there to see how they counted steps, and they use a log to be a bit more symmetric in the way they counted it, and less detailed. But if you're really interested in the detail. In the state, they obviously considered the availability of the user, as I've already described, the current features, location, the previous step counts, yesterday's step count, the temperature, how active the participant has been over the last week at this time. They also had this variable that if the user was sent lots of messages, they would discount the messages. So lots of little parameters that help this reinforcement learning framework. So how is reinforcement learning applied to this system? I've taken a couple of formulas from the paper, which you see here, and I'll try to go through it to make you understand a little better. So the reward function at time t, when the system is in state S for this user, and the action is 1, meaning sending a message to this user, is defined by this formula. The same formula defines also the case when we don't send the message. So the effect of sending a message is essentially the difference between doing the action or not doing the action. And in their system, this is equivalent to considering a vector of features, which are defined quite loosely, but they include the location of the user, the up engagement of the user, the previous dojo, so how many messages the users have received, and the step variation. So all of these are kind of summarized in a feature vector, which is multiplied by a Gaussian distributed variable, a random variable. And this random variable, as you see perhaps better in this formula defined here, is essentially a Gaussian and is dependent on the behavior of the users on the previous day. So essentially is the posterior of the Bayesian framework that is used to express the behavior, and it summarizes the behavior on previous days. So it's almost like a history. It's keeping history of the user behavior. Now, how do we use it really? In the next slide, I have some annotation for you to look at. But this probability here, which essentially is dependent on the same definition of feature vector and the random variable, defines the probability of acting. And the probability of sending a message or not to a user depends on the previous day's behavior. The previous day's behavior, as we said, is described as the Gaussian that is has mean and standard deviation dependent on the previous day's behavior. The paper has formulas that describe how this posterior is calculated. We won't go through it. But given this variable, we kind of condition it, we skew it a bit considering the feature vectors. And we use this variable as the probability when this value is more than a certain level of dosage. So the user cannot receive more than X messages a day. They decided that wasn't a good idea. And they have a sort of quota. And this variable is essentially defining that quota. But looking at it with a very high lens, the probability of acting, of sending a message, depends on this. So you draw a probability here from these values, and this means that you're really considering the probability of a user being of the behavior of the previous days. And you use that probability as the parameter of Bernoulli distribution. And then you sample from the Bernoulli distribution for an action. So you decide if the action should be sending a message or not by using the Bernoulli distribution distributed using the probability that is derived from this, which is history of the previous days. I hope this was clear enough, but you can look in the paper if it wasn't. Did it work? This is the ranking of participants for which the application worked and non-worked, the days in the study, many days in the study for some of the participants, but in fact, this participant you need to watch for, and the difference in number of steps. So for some participants, 5 and 7, this worked. They really increased the number of steps. For some, it didn't, but this was the longest lasting participant in the study. And so if you do go and read that paper, you will see that they reason quite a bit on the results. And on the top is the result graph, the results graph for user 4, which is this user for which the effect didn't work. So you see the treatment effect over the time is decreasing. So at the beginning, there might have been some reaction to the treatment effect, not much, but then 0.5, yeah. And then it just decreased and went down to negative effect. What you see here, though, is this is the probability of sending messages, essentially. And although it does follow a bit the fact that the user is less active, it doesn't quite go to 0. It keeps trying and trying. And in the paper, there's a discussion of, is this best? Or should we have adapted and perhaps not send messages anymore to this user, or use a different kind of pattern, perhaps send a bit more on one day or less on another day? So it's a discussion about that. On the second row, there is a graph for user 7, and if we go back, user 7 was the one for which the difference was considerably high, and he also had he or she had a large number of days in the study. For this user, the step worked again in this case, but notice the difference on the y-axis back to the top. So there was a significant effect initially, which declined a little bit, but was still quite high. This is mirrored by the probabilities of sending that message. We kind of ignored the red. The red is the original row sending message probability, which is corrected by some of the values that we have introduced in the formalization in the graph before. So let's look at the black. And notice that the probabilities are all clipped to 80. So, you know, the system also clips the probability. You never go above, and it's never 100% probability of sending a message. And so the user is sent quite a bit of messages, but notice here the behavior declines around the 10th of July. So 10th of July, the user becomes a bit less active, but the system takes until about the 16th of July to realize that and send a bit less messages and adapt to the user behavior, and then goes up a bit and tries again to try to make more active. But then, yeah, so there's a discussion there on what would make sense. The literature, you know, the jury is out on what really is a good model for this. And it's interesting, it's a very difficult problem. This is another example of one of the smoke cessation graphs, where here is the difference of reaction time within 30 minutes. Reaction time on minutes are on the x-axis for both graphs. One graph talks about messages that were sent considering location data, so geofence. When you are in a particular important location, the message was sent. Here is just messages that were sent at random times of the day. The probability, essentially, of opening a message earlier was higher for the geofence message. 79% of the user viewed the message within 30 minutes, and 54% of the user view the message within 30 minutes. So there is a signal that consider location for these messages might allow you to get the attention of the user a bit better. So in conclusion, this is a very interesting area of research, and many researchers are looking at how to not just what works, what messages work, what kind of context we can sense and integrate dynamically to adapt the intervention dynamically, not just statically offer interventions that make sense at specific time, but also dynamically adapt and dynamically adjust the messaging as well as the time and the number of messaging, but also study how to evaluate this problem. What's the best randomization techniques are for this sort of problems? And that's a bigger area of research than just for digital health. This is something that's been studied over the year for quite a long time. Thank you.